health sector in crisis.
Expressing concern over the poor state of the hospitals across the state.
The hospital is highly depleted.
A lot of our structures are dilapidated.
Governor Dauda Lawal has declared a state of emergency in the health sector.
Microbiology, blood transfusion, chemical pathology, all the clinical cases that are carried out were carried in December before.
In a bid to fulfill his promises of infrastructure
And now to Zamfara, where Governor Dauda Lawal has declared a state of emergency in the health sector with a determination to revamp healthcare delivery. Phyllis Darifai has details and will return with business.
The current state of healthcare facilities in Zamfara is disturbing and unacceptable. That's according to Governor Dauda Lawal. He says the sector needs urgent intervention considering its poor standards, lack of modern facilities, and experts, among other things. Governor Dauda Lawal stated this while declaring a state of emergency on the health sector during a statewide broadcast in Gusau.
I'm declaring a state of emergency in the health sector of Zamfara State on this day, Tuesday, January 30th, 2024. This decision is made with great concern as I had declared a state of emergency in the education sector of the state just 2 months ago on November 14, 2023. On Sunday, January 28, 2024, I made an unscheduled visit to General Hospital in Gusau to assess its condition. I was shocked and worried by the unhealthy and poor environment that patients seeking medical attentions were exposed to. It is not just the infrastructural decay that is affecting the health sector in Zamfara State, but the working condition of the health care service providers as well as their welfare is also of great concern.
Expressing concern over the poor state of the hospitals across the state, the governor said the facilities are in urgent need of state-of-the-art equipment and more workers.
In the heart of Nigeria's northwestern region lies Zamfara State, a land known for its rich culture, history, and resilience. But like a wounded lion hiding its pain, Zamfara has borne scars of another kind, a health sector in desperate need of care. For years, the state's health sector struggled with aging infrastructure, limited resources, and a yearning for reform. But today, a new dawn is breaking with the administration of Governor Dauda Lawal, who has pledged to heal the Zamfara's healthcare system.
The hospital is highly depleted in terms of the infrastructures, no equipment or supportive gadgets. In case of any serious conditions, we have to refer patients to either FMC or Bakura specialist that we have been bothering with a lot of patients that we're supposed to take care of. But due to lacks of equipment, we cannot do that. But we thank God He now supplies it us, and we can do our able to standard that we can give the services to our patients. Inshallah.
Before Governor Dauda Lawal's tenure, the health sector in Zamfara could be described as a ship adrift. Hospitals and clinics across the state struggle with scarce amenities, limited equipment, and inadequate staff. General hospitals were not better than village dispensaries in terms of service delivery and equipment. With a doctor-to-patient ratio as low as 1 per 10,000 people, patients traveled miles, mothers in labor, children with fever, all in search of medical attention that often wasn't there.
Initially, it was not clear. Before the hospital was renovated, we don't have the lab in this hospital because we have 2 single rooms which you conduct all the tests, including pathology unit, medical microbiology unit, blood transfusion, chemical pathology, all the clinical tests that are carrying out were carrying in the same room before. But now, alhamdulillah, look at, we gather all the laboratory from the reception up to the medical microbiology unit, up to the hematology blood bank unit, chemical pathology unit. And all the machines are there, a new one, and they're isolated. And we started using them gradually.
My name is Zahara Tujubu, the head of Nursing Department, General Hospital, Gusau. What I would like to say about the Zamfara State health care sector before, there's a lot of challenges in terms of manpower and the welfare of the staff, lack of annual increment in salary, stagnation of promotion. Even if you are promoted, it will not benefit because there is no any salary increment. It will not be implemented. But now we have seen a lot of changes in terms of staff welfare and in nursing department. Though we are not, the nurses are not enough, but there's a lot of improvement in that aspect.
When Governor Dauda Lawal took the oath of office on May 29, 2023, he knew the journey would be tough, but he had a clear vision. As a beacon for change, he is absolutely ready for the task. A healthy state, he always says, is a prosperous state, as anybody, regardless of his social status, can fall sick and demand the services of a good healthcare system that will take care of his ailment. This patriotic effort of Governor Dauda Lawal has marked a turning point with appreciable increase in the healthcare budget. Some hospitals across the state now see a new life.
My name is Dr. Alina Mohammed Hassan, Medical Director, General Hospital, Gusau. I've been working in Zamfara State since 2008 after qualification and completion of NYSC. Over the years and presently, we have seen tremendous improvement in the health sector, especially with the coming of this present administration, when His Excellency declared a state of emergency in the health sector. He has taken giant strides in renovation of health facilities across the whole state, which my hospital is a beneficiary. It's currently being renovated in phases. Also, he has equipped the hospitals to provide the most modern equipment, provide conducive environments for health personnel to do their jobs without any form of hindrance, and as well as upgrading salaries of health personnel to the standard of the federal government. He has upgraded our salaries. Also, he has introduced a form of interactive forum whereby he engaged all heads of parastatals, ministries, commissioners, and directors in like a mind-rubbing stakeholders meeting. He engaged us and he listened to our problems and he told us his vision. Also, he also organized a training on best practices, attitudinal change, and work ethics and protocol, which I was privileged to attend in December last year. A lot of our structures are dilapidated. A lot of things were not working. Equipment were lacking, but alhamdulillah, all this has come to pass. Currently, we have structures where we are comfortable, we are happy to come to work. At times, we don't want to leave office because we are very comfortable in our places of work, and we have equipment to carry out procedures and provide the best services to our teeming population in Zamfara State.
I am Dr. Suraj Hussain, Medical Director, General Hospital, Dauda, Zamfara State. Under the leadership of Governor Dauda Lawal of Zamfara State, there was a total renovation of General Hospital, Dauda, and the construction of new structure that include medical laboratory department, dental department, radiology department, and also there was a provision of brand new medical equipment and the working tools, which is very, very important. It will ease our works. And also there's provision of the solar system in the hospital. There is some thesis, medical thesis, we do refer to Gusau capital, South Zamfara State. But now with the provision of the equipment, used like EUCR scanning, X-ray scanning, we have brand new machine there. we are doing that. Kaura Namoda serves as like a referral center in this zone. So at the end, on behalf of good people of Kaura Namoda, we really appreciate His Excellency Dr. Dauda Lawal for this important gesture to our people. Thank you very much.
Diagnostic machines, ventilators, dialysis units, giving hospitals the resources they so desperately need to function effectively. Recognizing that the heart of every healthcare system is its workforce, Governor Dauda Lawal seems to be aiming at a healthcare system initiative that will be accessible to every Zamfara citizen within few kilometers radius of every community, offering basic diagnostics, essential drugs, and access to clean water. To actualize this dream and change the embarrassing narrative on the health sector in Zamfara, Governor Dauda Lawal declared a state of emergency of the health sector, which kicked off with the renovation, modernization, upgrading, and equipping of hospitals across the state. Our general hospitals like that of Kaura Namoda, Maru, and Maradun that were previously understaffed, short of drugs and other essentials, now wear a new look with state-of-the-art equipment, trained and well-remunerated physicians and other health workers for effective service delivery. The breakdown of health project under Governor Dauda Lawal indicates a realistic financial commitment as follows. Zamfara Contributory Pension Scheme, 1.18 billion naira. Yariman Bakura Specialist Hospital, 1.3 billion naira. Repairs and construction of new structures in Government Hospital Shinkafi, 2 billion naira. General Hospital Talata Mafara has a peculiar challenge. For several years, this hospital has been begging for renovation. In a remark, former governor of the former Sokoto State, Malam Yahya Abdul Karim, said since the establishment of the hospital, it has never enjoyed the attention of the previous government. An inspection visit by Governor Dauda Lawal at Talata Mafra revealed the real and very appealing picture of the hospital. The terrible state of neglect suffered by the hospital makes it necessary for Governor Dauda Lawal to go beyond just rehabilitation, but construction of a brand new hospital. Other government commitments on health sector include establishment of zonal modern diagnostic centers to cost the government 5 billion naira. Primary Healthcare Development Agency, 7.3 billion naira. Total rehabilitation of Gusau General Hospital, 670 million naira. College of Health Sciences, 670 million naira. College of Nursing Sciences, 630 million naira. Drugs and Medical Consumable Management Agency, 531 million naira. King Fahad Women and Children Hospital, 217 million naira. Repairs and construction of new structures in government hospitals, Anka, Kaura Namoda, Gumi and Safi, to cost the government 4 billion naira. Hospital Services Management Board, 4.5 billion naira. All these and many others are on the pipeline with the commitment of Dr. Dauda Lawal towards fulfilling his campaign promises of rescuing this critical health sector. Members of the public and beneficiaries of these transformative initiatives on the health sector are full of praises to the government of Dauda Lawal. In today's digital age, Governor Dauda Lawal knows the health sector cannot afford to be left behind. He aims at a new digital record system to be introduced to track patients' histories, manage resources, and oversee personnel. All these are on the pipeline. When achieved, it will make it possible to bring specialists to rural clinics and reduce the need for costly referrals to urban hospitals. Governor Dauda Lawal's administration has made a giant stride, but the journey ahead remains challenging. Though the maternal mortality rate has dropped in Zamfara, still has hurdles to overcome. The need for doctors, more infrastructure and resources is an ongoing effort to transform the health sector by the government of Dauda Lawal. The governor has always maintained his position that the healthcare is a right, not a privilege, and that every Zamfara resident deserves access to care they need, no matter where they live or what they earn. It is in this spirit that he sponsored a medical outreach program through which people with various hernia-related ailments were attended to at the comfort of their location, free of charge.
I am Dr. Muhammad Musa Brunezawa, member committee of special modified outreach in Zamfara State. Outreach program is a program that is inaugurated by the state government to cater for the health needs of people of Zamfara State across the whole 40 local government. It works on some surgical diseases such as cataract, vesicovaginal fistula, that is BVF, groin swellings, and other surgical abnormalities. It makes a lot of impact to the people's or patients in Zamfara State, in the sense that we have operated almost getting to 3,000 patients in Zamfara State across the whole 40 local government. Majorly, it takes effect in 3 areas: in Yarim and Bakura Specialist Hospital, in General Hospital Gusau, and then in Tulpat, where we do operate on cataract, that is eye problem. So basically, many people benefited, and it helps in their lives. And you could imagine people coming with debilitated diseases such as hernia, hydroceles, lipomas, and other conditions that they were operated freely and were given post-operative drugs freely and were given transport money back to their own respective areas.
Carefully selected medical experts handle these categories of patients who cried in pains but later smiled. Zamfara's story is not one of despair, but of resilience and hope. Under Governor Dauda Lawal, the health sector is beginning to stand on its feet, giving the people of the state assurance for a brighter future. Final words: where there is will, there is way. Through commitments and compassion, Zamfara is on the path of transformation, proving that even the longest journeys can be completed one step at a time.
The distribution of over 1 billion naira worth of drugs and emergency response materials to hospitals across the state is a significant
Another governor of Zamfara State, Dauda Lawal, has granted automatic employment to 16 nursing graduates.
Renovation of critical infrastructures in Zamfara State has been an ongoing exercise in the state. This is the flag of renovation ceremony of the General Hospital in Kauranamoda local government area.
Meanwhile, the Zamfara State Governor Dauda Lawal has also reaffirmed his administration's commitment to improving healthcare and education in the state. The governor disclosed this while hosting UNICEF Nigeria County representative.
Bismillah ar-Rahman ar-Rahim. In the name of Allah, the most beneficent, the merciful, I'm here today in Maradun to commission this reconstructed facility in Maradin local government today, inshallah, for the sake of humanity. Bismillah ar-Rahman ar-Rahim.
You see, number one thing is I refuse to be distracted by anybody. I remain focused, and that is the essence of governance. For any responsible leader, you need to look at the situation. do effective planning and be able to remain focused and deal with the situation. And that is exactly what we're doing.